Welcome to World at Work TV. I'm Allison Avalos, and I'm joined by Paul Henry of the Brinks Company and Dr. Lena Cheng of Doctor on Demand. Paul, why did Brinks decide to offer telemedicine to its employees?
We felt that it was part of a multi-pronged approach that we needed to take to be proactive about getting our employees to be healthier. We've had medical claims inflation that has doubled that of other companies for the last 4 to 5 years. As such, we thought that we needed to do a couple of things. One is we needed to get serious about wellness. Secondly, we found that our employees weren't taking the actions that they needed in terms of early intervention when something went wrong, so that we can catch them before they get to chronic stages. One of the tools that we have found to be very helpful is telemedicine.
What were some of the considerations in who Brinks chose to partner with?
Well, we have a small staff, so we wanted to have somebody who was expert in doing this. We wanted to have a company that had good brand recognition. So in addition to having a seamless rollout of the program, we wanted to have somebody that would help us market it. We wanted to have a company that would have very good coverage, since we are in 150 locations across the U.S. So it was important that we were going to have access for our employees through this app.
What advice do you have for other companies considering telemedicine?
I think companies need to really look at what their goals are of the program. Our goals were a quick implementation, trying to get utilization, to get emergency room visits down, and have people use an app like this in order to get the care that they needed for several of the types of conditions that you can have taken care of through this type of application.
What does success look like?
Well, I think increased utilization is important. So we incentivized our employees through making the copay to use Doctor on Demand less than the copay from their standard doctor visits. We want to increase utilization because we feel that an ounce of prevention is worth a pound of cure. And so we want people who have in the past neglected to go to the doctor to have the tool that's available for them to find out what it is that they need to do to correct whatever the problem is.
How are things working at Brinks?
We had a very smooth rollout. It took less than 2 months for us to roll out. It was probably 4 to 6 weeks. With their help, we're able to market the program very well in each of our 150 locations. We ran a promotion where we had the ability for people to win awards if they just simply went on and registered for the app. And now we're starting to get people to convert now over into actually using Doctor on Demand. And in particular, it's been very helpful to increase utilization because the first visit's free.
Lena, what trends are you seeing in telemedicine for employers?
Well, what we're seeing right now is that employers have a lot of interest in telemedicine. I think there's a lot of recognition that telemedicine is a great way to reduce costs and bring some convenience and increase productivity for their employees. And so with increasing usage of things like smartphones, and certainly laptops are equipped with front-facing cameras, it's really a great setup for employees to be able to access telemedicine very easily. And so with the rising healthcare costs that employers are facing, we're seeing a lot of interest from employers.
So why is this a good time for employers to consider telemedicine as an option?
Well, I think what we're seeing is that there really is a lot more mobile usage across the board, both in employer populations and consumer populations. And so you see this rate of smartphone ownership and usage of laptops with those front-facing cameras at an all-time high, and that's only growing year over year. Of course, with the way that a lot of healthcare plans are designed now, a lot of employers are looking for plans and programs that can help their employees kind of take more ownership over their healthcare decisions. And this is a great way to do it. This is a very consumer-friendly product that we have, and it's very easy to use and very convenient.
What type of company is a good fit for telemedicine?
We have a lot of different types of employers in all different industries, a lot of different sizes. Our smallest company is Castlight Health at 300 employees, and one of our largest ones is Comcast, NBC Universal, which has about 200,000 members. So what we're seeing is that this is a great fit for employers of all different sizes, industries, technology levels, ages, and demographics. So it's a good fit for really any company that is looking to reduce their healthcare costs and increase their employees' access to high-quality healthcare.
Well, this sounds like a very progressive and futuristic thing to offer. I really appreciate you taking the time to talk to us today. Dr. Lena Cheng of Doctor on Demand and Paul Henry from the Brinks Company. For World at Work TV, I'm Allison Avalos.